Next, from the state capitol, we go one-on-one with Dan Long, Executive Director of the Commission of Government Forecasting and Accountability. This legislative agency prepares economic forecasts. We'll hear how the state's revenues are doing 1 year after the increase in the state income tax, and whether these funds are enough to cover rising pension and healthcare spending. This runs about 30 minutes.
Dan Long with the Government Commission on Forecasting and Accountability. Thanks for joining us again on the Illinois Channel.
Oh, thanks for having me, Terry.
For just briefly, for people who may never have seen any of our previous interviews, tell us in a nutshell, what is it you do for the state?
Well, the Commission is a legislative, or part of the legislative branch of government, and we provide revenue estimates and projections on the economy for the General Assemblies. They get ready to debate the budget each year. We also have oversight of the state employee pensions, published report every year on the financial condition of the pensions. We also analyze all of any pension legislation and the impact that might have either in reducing or increasing pension costs. Same thing with the revenue. Any significant bills that go through the Revenue Committee that have an impact on revenues, we do an analysis of those bills and report on whether it's going to increase or decrease state revenues. We also administer the State Facility Closure Act, which has kept us busy recently with the closures announced by the governor.
But in essence, you produce the numbers, right? As far as
correct.
You're the accountant for the state, so to speak. Is that somewhat?
We generate or project how much revenue the state will have available each year as they begin the budget process and how much they can allocate to human services, education, law enforcement, all of those.
Do you, you know, something I didn't know until you just were saying that, when the budget director puts together a budget for the governor, do they crunch their own numbers or do they use your numbers as a baseline?
No, they do their own. They do their own for the executive branch. We do the similar projections for the legislative branch.
And I guess depending upon which administration is office at the time, you either agree with them or don't agree with the numbers that they might have come up with.
Correct. I mean, it's kind of a check and balance, so that they don't, you don't get somebody that's artificially inflating the revenue numbers in order to balance the budget. And this year, we're actually pretty close on our revenue estimates. Of course, you look at the same economic data, you look at the same historical data. So this year, we're within, 50 million, I believe, of each other on our revenue estimates.
When, for the audience, just in case they don't follow government gibberish, as they say, the fiscal year is named for the year in which the budget ends. So this being 2012, we're in fiscal year 2012, and that ends for the state of Illinois June 30th of every year.
Right. The fiscal years in Illinois run from July 1st to June 30th.
So given, as everyone knows, we had a tax increase just over a year ago. The income to the state comes primarily from the personal income tax. I have a figure in front of me that accounts for some 37% apparently of your net income. And the next is the sales tax, which contributes about 22%. So those are the two greatest resources. The third is federal sources, funding from federal sources, which at this point for the fiscal 2011 base revenues accounted for about 18%. So those three, income tax, sales tax, and federal sources, are the three major sources. As you analyze where we are today, what's the big picture? How are your projections of how the revenues for fiscal 2012 rather, how are they coming in according to projections?
Well, fortunately, they're coming in pretty much on target. I think that the overall increase in revenues this year, with the income tax increase, is projected to right around $3 billion. Through March, we've gotten in $1.8 billion. We expect a significant increase here in April, because that's obviously when people file their income taxes, and that since the rates were enacted in February of last year, we expect the final payments to be higher this year, because it takes companies a little time to get the tax tables and everything in place. So we're on target with our revenue, with the revenues we have projected. And sales taxes come in particularly strong. I think it's a result of maybe consumer confidence being up, and people would put off delays and some big ticket items, particularly with cars and maybe some other things. And so the two big drivers, as you mentioned, the income tax and sales tax, are coming in as we projected.
Do you know how much more revenue we would have for this fiscal year 2012 than we had for 2011?
About $3 billion, right around $3 billion. And that's a result of the increase in the income tax, primarily.
Now, some people might go, while the state has $3 billion more dollars, I guess all of our financial problems are solved.
I wish that were true. Unfortunately, back in fiscal 10, there was a lot of debate about making cuts in programs, and those cuts that were proposed weren't made. Instead, we took $3.5 billion from our pensions that was allocated for pensions in the budget, and used that to alleviate or not have to make those cuts. But then what happened was you still had to make the pension payments, so we borrowed $3.5 billion in fiscal 2010. And then when we got to 2011, well, you didn't have $3 billion in growth, so we had to borrow again. So over those 2 years, we borrowed about $7 billion in short-term notes to make the pension payments. So this money that we're initially getting in from the tax increase has to go into the base in order to shore up the pensions, because you can't keep borrowing every year to make your pension payment. So all of that money from the income tax increase basically has to go into the base in order to shore up our pensions. And then the amount that we borrowed, is the debt service on that between now and 2019 is right around $1 billion a year.
$1 billion a year for the next 7 years, approximately.
That's right, in order to pay that off.
We often hear that the state has been late in paying its bills. Where do we stand? Are we getting caught up, or where do we stand on paying bills?
I think we're treading water. I don't think we're not getting worse, but I don't think we're getting any better. I think this year the budget was predicated. It's constructed on carrying over $5 billion just in the normal operations of state government. In addition to that, it was the budget included, like, in order to balance it, they stretched out the payment cycle for Medicaid, so that we anticipate there'll be about $2 billion in Medicaid payments will be carried over into the next fiscal year. We've got about $1.3 billion that's outstanding that we owe to the medical providers for the State Employees Group Insurance Program. They expect that to be about $1 billion by the end of this fiscal year. And then there's about $500 million in corporate tax refunds. So we're going to continue to carry over probably about $8.5 billion. I don't see that we're going to make a big dent in that. In fact, a report that we just published on the State Employees Group Insurance Program shows that the payment cycle is going to be extended a little further for providers in fiscal year 2013. Somewhere around 220 days now for payment to somewhere around 260 days or 70 days. So anybody who's providing medical care to state employees right now, or even to Medicaid, I mean, you're looking at 7-8 months before you might get a check. 270
would be almost 9 months.
Nine, yeah, probably closer to 9. You're right. Yep. Yep, I'm thinking of last year. So it's getting...
So the health providers are going to wait 9 months in the fiscal year that starts July 1.
Correct.
And are we also, in addition to, the governor wants to cut the Medicaid spending, are we also going to be cutting the reimbursements in addition to stretching them out?
You know, they've got a group, a Medicaid group that's working on that. I don't know if they've, I believe they were supposed to announce something yesterday, but I haven't quite finalized what the solution might be. Certainly rate cuts is one of the things being discussed. I have no idea if that'll be part of the solution or not. We'll have to wait to see what that working group comes up with. But clearly the administration's indicated that rate cuts, they believe rate cuts should be part of the solution. But we're not involved in that. That's a separate working group of legislators that are working with the administration on that issue.
Looking at a chart you have here, you had the general revenues for fiscal 2011, which was last year's fiscal year, was $30.2 $3.4 billion. Do we know what the general revenues for 2012 would be?
Somewhere around 33.2. So that's what I indicated, about $3 billion more than 2011, which is a direct result, of course, of the income tax and also, you know, the very good sales tax revenues we've been experiencing this year.
So your income this fiscal year approximately $33 billion in that neighborhood.
Correct.
What would the expenditures for this 2012 fiscal year be?
Oh, they're projected somewhere around 33.7, but we started the year carrying over 5.2 billion in unpaid bills. So that's what I mean, that we're not getting worse, but we're not making any headway in terms of
Yeah, to get caught
paying
up,
off
you
the
would
bill.
have to have maybe 35 billion instead of 33.
Correct.
And
And then
then
you
start
could-
using that 2 billion to pay down the past 5 billion.
That's correct. This year, we carried over coming in at the end of fiscal 2012, we're projected to carry over right at about 5.1 billion, and in 2013, we're projected to carry over right around 5 billion. So you
So
only
we
get
keep rolling over $5 billion, carrying that
Right.
debt load
Right.
and paying.
if everything goes according to plan,
The
we'll
interest
pay,
on
we'll pay
that.
down 100 million. So we're still, and that's not all of the, like I indicated, that's not all of the outstanding bills. That's what's in the budget. It doesn't include some of the Medicaid bills that haven't even got to the comptroller's office yet, that are perhaps over in Department of Health Care and Family Services. And it doesn't include all of the state employees group insurance bills, because that's paid out of a separate fund. It's not necessarily, this is GRF we're talking about here, and that comes out of the state employees group insurance fund. And that's, again, that's another billion or so. So and then a $500 million in the corporate income tax refunds, which is a separate fund for that as well. So the total's still $8.5 billion.
So would it be, just to keep this simple, are we roughly having a balanced budget, but we have this $5 billion in backlog? Is that?
I think that could be an accurate statement, yes. I think that our revenues and expenditures are matching up fairly well, but we've got this hangover from a few years ago that we're not able to pay
Have
down.
enough extra money to pay that down yet?
That's exactly right.
Now, one of the big discussions going on in the state legislature this year is addressing the state pensions and trying to get a handle on those costs. Irrespective of what they do, why, from a financial standpoint, what is the challenge on paying the pensions? What kind of a cost factor are they?
Well, I think what they're trying to do again is reduce the liability, and we made significant pension reform when they passed the two-tier pension system. I mean, it reduced our unfunded liability by something like $250 billion, and it'll reduce our payments by $71 billion between now and 2045. But that's for people who come in the system after January 1st of 2011.
Can I interject? When you say $220 billion, again, you're over the period between now and 2045 we're talking.
Right.
I mean, just to,
Right.
It's just as if you refinanced your house over a 30-year note, you're going to save money over that period of time.
Well, it wasn't really refinancing. It's simply that people coming in after January 1st, 2011 have a different level of benefits.
Right, no, I just meant to say, in other words, just as a homeowner would save money over a
Right.
period of 30 years.
Absolutely.
The state's not,
It's a long
it's
term-
easy to get lost in this.
It's a long-term financial plan to get to 90% funding by 2045.
And that's the other thing. When we say, how much are we funded? Yesterday, we taped an event, and I think they were talking about, there's 5 different pensions, so there are different levels of funding, but there's somewhere in the area of only like 38% or so funded.
Overall, that's correct. The funded ratio, as they call it, between your assets and your liabilities is around 38%.
Now, I would say that's a very dangerous level of funding. What would be, do we have to be at 100% funded, or at what level are we out of the woods?
The funding plan we're operating under would get us to 90% by 2045. Now, there's been others that have argued, well, why, 80% or 70% would be fine. And that might be true, and we've looked at that. But even if you lowered it to 80% or 70%, it's not going to make a significant difference in terms of what the state needs to contribute towards the pension systems between now and 2045. For instance, this year, I think the payment for the contributions to the pension systems are right around $5 billion, $5.1 billion. Next year, they're projected to go to $5.9 billion. So there's $800 million more the state will have to contribute to these pension systems. That's why you've heard a lot about shifting the normal cost, which is the cost just for the pensions for a given fiscal year, not the big unfunded liability. For example, teachers' retirement system, the normal cost is about $750 million. So there's been some
A year.
A year. So there's been some discussions about, well, we need to transfer that and make the school districts pay. The same thing for universities, which is, I think, somewhere around $350 million a year, and transferring that to universities. Well, that would obviously reduce the state's cost by $1 billion.
Although for the taxpayers, the cost wouldn't go away. It's just out of whose pocket you're, or who you're writing the check to, I suppose.
Yes, that's true. I mean, some would say, well, that's going to
I would either be paying my local school district the money and my possibly through increased property taxes, or
but I think it'd still have to operate under the cap, so I don't know if they could actually just increase property taxes. I don't think that's something they'll have to do. They may have to
in that case, would that just be an unfunded mandate then if we sent it to the school districts?
I guess you could call it that. Somehow they'd have to absorb that amount. Now, how this is structured, again, like I said, there's another working group, a pension working group that's trying to work on this issue as well. And I don't know that you transfer all $750 million down to school districts in 1 year or you phase it in. It seems to me like it might be something that would be phased in over a few years.
Healthcare costs for state employees, how big of a factor is that? And that's also part of the discussion that is somewhat tangential and gets tied up in maybe a negotiated deal on the pensions. We don't know what that deal would be, even if there is a deal, but it's in discussion, as we just said, this spring.
Well, state employees, like I said, the outstanding bills right now are $1.3 billion, and it's just a function of how much they allocate, how much. There's a limited amount of dollars available. That's why we have this big hangover of unpaid bills. So it's how much they allocate towards these payments. The issue is not so much with active employees. A few years ago, we were going up double digits like any other employer with healthcare costs. I think this year it's more in the range of 7% or somewhere in that range, which is still higher than inflation. But the focus has been more on, not so much on actives, although there could be some changes with the upcoming negotiations with the union, whose contract ends this year, and that pretty much drives a lot of what goes on with the health care benefits. But with retirees, as an active employee, you contribute towards the premium. As a retiree, you don't pay anything. So there's been some discussion. We had a report that was done by Mercer, a well-known health consulting firm, and we're one of the, maybe the only state, or certainly one of the only couple states that don't require retirees to pay any contribution toward their health care premium. So there's been some discussion of starting to have the retirees pay something towards that health care amount. I think the question is how much.
I was going to ask, have you run any of those numbers just to say here's how many retirees we have, and if they paid $50 a month or whatever the number would be?
We have, and if you tried to recover the national averages, they pay about 50% of the premium cost for both the employee and the dependents, and that would generate probably about $300 million. The issue's been, you want to do it on a fair basis, so that it's based on the number of years that you had in the system and how much your pension is. So if you had a lower pension, I think the average is, and state employees retirement system is like $27,000. They might pay less than somebody who's making a pension of $100,000 that may have worked at a university or something. Usually about $50,000, you may pay a little bit higher amount. So that's, I don't know if that'll be passed this year. There's this bill in the Senate that it's actually out of committee and on the floor. Actually, our co-chair, Senator Schoenberg, has been working on that issue. And I don't know if they've come to a resolution yet, if they're going to run that or not.
So
it's all
$300 million isn't chump change, but even if you did that, you're still not getting too far along the lines of paying down the $5 billion in past bills.
No, but $300 million is certainly a help, and then that'll increase in the out years as you go forward. That becomes a bigger number.
Sure. Yeah. If you sat down, or if you and I were sitting down, can we just sit here and say, well, the economy's been slow, but if it turns around, we'll just have more income coming in as the sales tax, as you said earlier, has increased and been surprisingly strong. Can we grow our way out of the current budget deficit in Illinois?
I think it'd be very difficult, especially when you look at the current economic trends. Fiscal 2013, the average unemployment is projected in Illinois at 9%. So it's 9.2 now, dropped to 9%. The gross domestic product is, around 2.5%, 2.8. It's not going to happen in the next few years. Come 2015, the way the income tax is structured, the rate drops from 5 to 3.75, beginning in January 2015. So between 2015 and 2016, the amount of revenue we got from the income tax is going to drop off by about $4.5 billion. And I don't think that we could possibly increase economic activity to cover that shortfall. And that's something that, they call that the cliff effect. And we'll have to, I'm not sure how that'll be dealt with, but it's certainly an issue that's hanging out there. Because, like I mentioned, we borrowed the $7 billion in short-term notes because of the money we took from the pension system in fiscal 2010. Our debt service on that's $1 billion between now and 2019, and then you've got the tax that starts to drop off in fiscal year 2015. So
it's very easy to get lost in all these numbers. We're trying to keep it somewhat simple and yet shine a light on where the issues are. But I guess the question is for all those voters who are going to be voting on people, and some candidates are going to be saying, I won't vote to extend the tax, as you just said, the cliff effect. Once the income tax goes out, you're going to lose $4 billion. So how do we balance this budget? If Medicaid is a big expenditure, the governor's talking about cutting that some, but some of that is inflated because Governor Blagojevich increased the Medicaid rules. Can we cut back on who's eligible, or what areas, I suppose, and I don't mean to put you on, you're non-political, so I don't want to ask you a political question, but if you were advising lawmakers as far as how to balance this budget, what levers should they pull? Where should they be?
Well, I think that's one of the things that is being discussed right now. You've got to rein in spending. Medicaid's a large spending item in the budget, as is human services, as is education. So I think that the House has adopted a resolution with a revenue number that's even less than what we're projecting next year. And
they project, what number did they use?
I think it's somewhere around 33,221. We're at 33,392. So it's at least $700–800 million less than what our projections are. And then they adopted a resolution which allocates a certain amount to each of the appropriation committees for human services and education and public safety. And they've got to work within that number. So I think what they're trying to get control of the spending, and then you can take that $700–800 million and start to pay down some of this backlog of bills.
Almost purposely forced savings by underestimating the revenues.
Well, that's their estimate.
I mean, that's
they would say
that's
an accurate estimate, and it might be. I mean, it's not out of the realm of possibility.
Well, it might be because
but clearly
state income
they've
tax
indicated that the plan is to take any excess revenue and use that to pay down these outstanding bills.
Do you know
that is the plan?
What interest rate? In other words, if we pay down the $5 billion and we're paying the interest on that I think you said was about, was it $1 billion a year we're paying in interest?
That's on the notes. That's on those notes, the money we borrowed actually for the pension system.
Okay.
Because we took money out of the pension system.
I guess what I'm trying to
The outstanding bills, I believe the interest rate they pay is around 12%.
That's what I was going to, so how much savings will we be as we pay down those notes? If we're paying 12%, you'd have a fairly significant savings.
It's a few $100 million. I don't remember the exact amount. We can get that number, but it's somewhere in that range, yeah. If we paid it off completely. Plus you can have some of the, if you can get it paid off, then any additional revenue you have coming in, you can start to, maybe.
So if we pay off those notes, you save, say, $200 billion. The other, we talked earlier about saving $300
million, right.
By having maybe that retirees put in some. There's $500 million there.
You start to, if you reduce the Medicaid liabilities, that's $1.3 billion in state funds. And then the other side of it, you're looking at some changes to the pension system for active employees, which I haven't seen a plan, so we're not sure how much that would generate, but I'm sure that they want to try to, get, around $1 billion or so for that as well. So then you start to make some progress.
So as a recap, I guess we would say, or you tell me if this is fair, as you said, we're treading water. We've stopped declining as we had been in some previous years. We're no longer borrowing to make the pension payments. Is that correct?
That's correct.
But looking forward, the big challenge is one of the questions is going to be, is the national economy going to turn around to see how much more growth we have? But the other big challenge that we know is going to be coming is the tax increase that we passed last year is going to end, and so we'll have to face as a state whether we extend that or not.
Yeah, the tax we passed last year, it was from 3% to 5%. It's going to drop from 5 to 3.75. But in terms
so not entirely off, but
no, and then it drops in again, but not till like 2025. But in the immediate future, 2015 is not that far off, and we're doing fiscal 2013 now. If you lose $4 billion, that's a pretty big reduction in revenue.
Puts it in context. If you're going to be asking the retirees to pay something, and you cut here and cut there to scrimp together 500, sounds funny to say, but $500 million. All those efforts will be for naught financially if you lose $4 billion. As far as getting ahead.
That's correct. It's a public policy issue. The way the law is written now, it'll drop off. They could vote to extend keep the rates where they are now a couple more years. So I'm not sure how that'll play out. That'll be up to the General Assembly.
That's why we elect people. They got to make those
exactly
decisions.
right.
So you just give them the numbers.
Those are the tough votes.
Well, and we appreciate you sharing the numbers with us, so as voters we can kind of have in context some of these economic issues as we wrestle them with this election year. So Dan Long, thanks again for joining us.
Well, thank you.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.